Hi there, my name is Ian Rudd. I'm a general paediatrician. I'm a paediatrician with an interest in children's hearts and kidneys. I'm interested in undergraduate education and paediatric education. I grew up in South Africa and went to school in South Africa and Wales, but I've lived and worked and raised my family in England. I'm a father, a husband, a son, and none of these are terribly remarkable things, and certainly aren't a good reason for me to sit around talking about myself to a camera in my bedroom on a rainy Wednesday morning. However, the thing I'd really like to talk about today is a thing that happened to me exactly a week ago. I was unconscious and under the surgical anaesthetic care of the team in Cambridge whilst I had one of my kidneys removed. And so I sit here a week later being able to say all the things I've just said, but also to say that I am now a live kidney organ donor. This is quite an unusual thing. It's been quite a big deal for me. And I've learned an awful lot that I didn't know as I've gone through the process. It's been quite a lengthy process, at times a very stressful process, at times a very uncomfortable or scary process, but also something that has been unbelievably rewarding and life-enhancing. And what I thought would be really helpful would be to talk a little bit about that. I think it might be helpful if you're a healthcare professional who is involved in any way in live organ donation or thinking about these matters. It might be helpful if you or a member of your family is possibly looking at becoming an organ donor and thinking about it. I think it might be helpful to you, in fact, if you're in the unfortunate position of needing an organ transplant to survive or to have a quality of life that can be improved by organ donation. Because I don't think it's terribly common, and certainly I've not seen any resources around that really help people like me to face these really hard decisions in a way that helps me to think, okay, well, these are some tough decisions. What do those decisions look like? How do I live with those decisions? How do I make them stick? And how do I make the best of that situation that I possibly can? And that's what I'd like to talk about today. I'd like to make it very clear that my pathway is my pathway. I can only speak as an expert in my life. I'm not an expert in kidney transplants. I'm not an expert in adult medicine. And even if I were, my experience is only my experience. I cannot tell anybody else how to make good decisions or the right decisions for them. I can't tell them what a good decision looks like. I can't tell them how to live with those, and I wouldn't for 1 second want to. But I can tell you what I've been through, and I can tell you what I've observed and what I've thought about. And if that's even vaguely helpful to a small number of people, then I think this video is worth doing. The other thing I'd like to say is that I'm really talking about live organ donation. The kidney is an extraordinary organ for many reasons, and one of the most extraordinary things is actually we've got a spare. This isn't the case for your heart or your liver, but it is the case for your kidneys, and therefore the ability to do a live organ donation of your kidneys means that people in renal failure, people who are going on to dialysis and are facing chronic kidney disease, are in a unique position compared with most organ failure, where they can be put in a position where they need to go and approach the people that they love and ask them to do the most extraordinary thing. My sister didn't choose to go into kidney failure. My sister didn't choose to have one brother. My sister didn't choose any of the situations that she found herself in. And she certainly didn't choose to have to come to me and ask me to give her a body part to help her have a decent quality of life. This was a Christmas present that is the biggest Christmas present I could ever give another person. And it is the last thing that she wanted. And it is the last thing that she wanted to ask me to do. And I can't speak for anybody else or for anybody else's situation in terms of what this looks like and feels like. But it is an utterly bizarre situation to be in. For most people, if they need a transplant, they are relying on the organs from people who are not going to survive or have already died. This is a very different conversation. And just as a slight aside, I would really encourage everybody who watches this and everybody who's thinking about these matters, unless there is a really, really good reason why you think you don't want to donate your organs after your death, or you don't want a relative of yours to donate their organs when they die, please, please give this really serious consideration. There are a small number of religious groups where this is a very big deal, and I can't speak to that. But if you are in a position to really change somebody's life by them being able to have a new liver or kidney or cornea or heart valves, and that is something, a gift that you can give or a loved one can give, then I think that is such an overwhelmingly amazing thing to be able to do, that I think there needs to be a really good reason, and often there are, but there needs to be a really good reason, and I'd really like you to have a think about that, so that you've thought about it in advance of the worst happening. But that's an aside. What I really want to think about today is this issue of live kidney organ donation. I want to talk a little bit about the initial conversation that my sister and I had. I want to talk a little bit about the process of my deciding what I was going to do. I want to talk a little bit about the process of going through the workup to get to the point where it was even an option. And then I want to talk a little bit about what it actually was like to go through the process this last week. So let's go right back to a conversation that my sister and I had about 2 years ago. We were walking out together with our families, and she came to me and she said, Ian, look, here's the thing. For reasons that are not important for this video, other than to say that she's otherwise pretty fit and healthy and well, and I know full well that she will look after the kidney that I've given her to the best of her ability. She came to me and she said, I'm going into kidney failure. And this is a big deal and I wanted to talk to you about it. So we had a conversation, and as part of that conversation I said to her, well, here's the thing. I know your options when you do go into chronic kidney disease and chronic kidney failure, and I know that one of the best things that could happen is that you're a recipient of a kidney transplant. And I want you to know that if and when the time comes for us to have that conversation, I need you to feel able to pick up the telephone. And I think this is the first thing I'd really like to address, is that we need to be able to talk about these things. Nobody wants to be in this situation. Nobody is pro-kidney transplant. Nobody thinks this is a good idea. It's not. It's an amazing bit of technology. The surgical skills and the medical skills to do it are extraordinary. But ultimately you are cutting a body part from one human being and giving it to another human being, which is an extraordinarily blunt technique if you think about it like that. But nobody wants to be doing this. If there was a better alternative, we'd use it. And so I think we need to be really clear that we can have conversations like this, hard conversations, because this is not an easy thing to talk about. And then my first message really has got to be that families, people with kidney problems, people with any degree of organ failure have to be allowed the space and the time to actually talk about these things in a way that's helpful to them and to the people around them. Because I walked away from that conversation, got on with my life, got on with my family, got on with my job, good days, bad days. My sister is not a huge part of my life. I love her very much, but she's not a massive part of my everyday life. And so it was only a few months later when she picked up the phone and had what I can only imagine was one of the hardest phone calls that she's ever had. She said to me, my kidney filtration rate is falling. My doctors have told me that I'm going to be on dialysis, probably within a year, definitely within 2 years. And they want me to talk to people about being organ donor. And as you know, you're on the list. And this is the second thing I'd like to talk about. There may be many good reasons why you can't be a kidney donor. And that's not your fault. You didn't choose to be hypertensive. You didn't choose to be a certain age or have certain illnesses. That's just the way it is. Nobody goes into this life choosing to have risk factors. However, I happen to be in the unbelievably good, fortunate position of, first of all, being really healthy, and second of all, knowing that I was probably going to be healthy enough that I could help my sister. And therefore I was in a situation of thinking, well, what do I say? What do I do? And I think many people approach this question in many different ways. And I've been surprised, if I'm honest, by how many people have come to me and said, what you're doing is an amazing thing. That's an incredible choice that you made. And by no means is this not a choice. I didn't have to do this. There was never any duress. I was never forced to do it. And Lord knows my sister certainly didn't make me feel like I had to do anything. But I suppose what really occurred to me and what I thought a lot about was, what were the things that were important to me? And what could I do to try and live out those values to the best of my ability? Now, I happen to be raised in a way that I think my commitment to my family and my family's well-being is a really important part of who I am and how I live. And therefore, I was thinking, well, how do I feel about my sister being on dialysis? Being in chronic kidney failure is a deeply unpleasant thing, but it's livable with. Many, many people do. They attend their dialysis sessions or they have home dialysis, and they can live their lives and they can work and they can raise families and they can be happy. But it is a grinding, relentless, hard path. And I know what that path looks like a little bit as a healthcare professional, but I've not lived that path. But I knew what was potentially in store for my sister, and therefore I had to think, well, can I do something to help? And the answer was possibly yes. And therefore I thought, well, what am I going to do? And the answer was, I had to go through the initial testing. And this is my second point, which is really, there are going to be people who just can't donate a kidney or to that particular person because of a blood group problem or some incompatibility problem or some health problem that's found with you underlying all of this. And that's not your fault, and that's not a failing. It's just the way it is. I'm absolutely clear that I love my sister and I would give her a kidney. I wasn't doing this for anybody else, and I totally take my hat off to altruistic donors who do this for complete strangers, because I personally could never put myself through that. And they will have a different story to tell, and I would be interested to hear that story, but it's not my story. However, what I do know is that I could not, in all conscience, decide other than to go forward with the testing. That doesn't make me a good person or a better person. That just makes me a person who has had a hard conversation with themselves, a hard conversation with the specialists and the people who they love and who care for them, and has made a decision that this is the right thing to do for me. And I do believe that if we're able to have hard conversations about what this really means, and what this really means for me, but also for the people who are going to live with me and be with me going through this, then generally we can find a way through it that's okay for everybody, and everybody can make a decision that they live with. And so I went for the testing, and I suppose the next thing I'd like people to understand is how unbelievably brilliant this process is. I have worked in the NHS for 25 years now, and I've never been so impressed with any aspect of healthcare that I've seen. And that's speaking as a self-righteous paediatrician who thinks that only paediatricians can do medicine well. But I would still say this was probably the best bit of medicine I've ever seen. Because what they did was they put me right at the centre of their care. And I was their patient, I was their sole concern, and the only thing that that team were interested in, the specialist nurse, the nephrologist, the multiple clinicians, radiographers, phlebotomists, everybody who was doing things to try and work out, was I going to be okay to give a kidney? I have had more tests in the last 18 months than I've had in the rest of my life. And they did them for specific reasons. None of them were unnecessary. They were done in a way that was beautifully organized around me, my life, my family, and my work. And they really made the absolute effort to make it very clear to me that at any point, if anything came up, or if I was unhappy or didn't feel able to proceed, then that was it. I walked away because I was their sole concern. They genuinely were not interested in my sister's well-being until they'd established that this was a go. And so when I met up with the nephrologist who was looking after me, and he did a careful physical examination, he went through my medical history, went through my psychological history, made sure that I seemed to be healthy and well. He looked at all my results, my blood tests, my MRI scan, CT scan, the DMSA scan that I had to make sure that both kidneys seemed to be working well, my GFR scan to make sure that my kidney function was okay. He sat down with all those results and he looked me in the eye and he said, I think you are fit to be a live organ donor. And that was a really, really important thing, because I knew that the only reason he was saying it was because he believed that it was safe for me to do. And there's nothing 100% in life, but this was as close as we were going to get. I was also assessed as part of that workup when I went up to Cambridge, where we had the operation. I met the surgeon who very carefully talked me through the whole operation. There were pictures and PowerPoint slides. He told me the risks of my dying. He told me the risks of having complications. He hid nothing from me at all. He spoke to me, he spoke to my wife, he made sure we were both completely comfortable with what we were doing. Because he's a man who's been around this loop many times. And he knows that I don't want to die. He knows I don't want to suffer. And he knows I don't want to be left with the long-term consequences of a decision that I made in good faith, but then things turned up later that I didn't know about. And so it was a very, very thorough, rigorous process. We were seen by a member of the team whose sole job was to make sure that I had been properly consented, that I understood the risks, I understood the benefits, that I wasn't being coerced, that I wasn't being given any money or any other reason to do it other than pure altruism and love for my sister. And once everybody was happy, that was the first time that Jenny and I were brought back together to start really thinking about this combined procedure. And so this whole process really took quite a few months. And the next thing I would really want people to understand is that it was done in a way that was coordinated and sensitive to the fact that I was still getting on with my life. I was having my appointments put back to back so that I was only going to the kidney centre 3 or 4 times for my investigations and for reviews. It was done in a way that was entirely driven by the specialist nurses, whose sole concern was to make this as easy and straightforward for me as possible. And again, this is something that I'm just not used to seeing in the NHS, and was something that was really quite inspiring and very, very impressive. And so what it meant was that we could meet up and we could start looking at provisional dates. And that date was put in the diary around my work commitments, my family commitments, my sister's work commitments and family commitments, and obviously the clinical situation in the hospital. Now with the whole COVID situation, that got pushed back by a few months, but as soon as they were getting their program back up and running, they did so. And again, we were communicated with beautifully in terms of planning, reorganizing the whole thing, and getting us in for our operation. And so I suppose what I'd really like people to understand is that at multiple points along this process, I was given the opportunity, so were my family, to really think about what this meant for us. What did this mean for me in the short term? Well, in the short term, I was going to be in hospital for a few days. I was going to have an operation which was going to leave me uncomfortable and in pain and recovering from an anesthetic. I was going to have an operation that had significant risks in terms of the risk of the anesthetic and in terms of the risk of the actual operation. But those were risks that we could mitigate and that we could reduce the risks. And what they talked to me about and what I took really to heart was the fact that I wouldn't go to start a new job or to run a marathon or to go to a driving test or to pass a medical exam without preparing. And actually I needed to prepare. And I did everything I could possibly do to prepare my mind and my body, my financial affairs, my home situation, my work situation. I spoke to work, I spoke to everybody, and I had some really hard conversations with people to make sure that by the time I turned up for my operation, I had done everything I could to make sure that the risks to me physically and emotionally and mentally were as small as possible, that the risks for my family were as small as possible, and that there were really very few loose ends that I couldn't tie up to make sure that all we had to think about for the last week was keeping me healthy and well. This was really important, and I would really want people to engage with this whole process of what they call enhanced recovery. Really thinking about what does it mean to go through this massive physical attack on your body, which is basically what an operation is, but to go through it in a way where you are prepared just like you would prepare for anything. We prepare women for childbirth. Why don't we prepare people for operations in the same way? The more I thought about it, the more I couldn't think of an answer, the harder I prepared my body. And I would really want people to think about what that means for them if they're going to be approaching this, to try and get themselves as physically healthy as they possibly could. In the process of the last 18 months, I lost a lot of weight. I exercised more than I had done for several years. I started doing yoga because I was worried about my flexibility and my muscles and my core strength when I had had the operation and couldn't move much. I thought about my diet and my nutrition and how to optimize that, how to reduce my risks of constipation after an operation, because that's an unpleasant thing that you just don't want in your life when you've just had an operation. All of these little things were things I could do something about, and I thought really hard about them, and I tried to do the best I could to reduce the risk so that I could approach the operation in the best mental state that I could and the best physical state that I could, so that I could then hand my body over to the anaesthetist and hand my body over to the surgeon, confident that I'd done everything I could to prepare myself, and they'd done everything that they could to ensure that it was as safe as possible. And this meant that when I went off to sleep this time last week, I felt incredibly calm and incredibly relaxed, even though I've never had an operation before, even though I was very scared, even though I knew that my risks of dying were tiny but not zero. All of these were true, but I wasn't stressed because I knew I'd done everything I possibly could to get myself into a position where it was as safe as it could be, and I knew that I was doing it for the right reasons, and that I'd really tried to think about what my reasons and what my logic was, and I'd had some really hard conversations with my family in the run-up to this, rather than just hoping it would all go away. I know that my work were behind me, that my work colleagues have filled in the gaps, and my secretary and I have planned everything, so that really all I've had to think about for the last week has been my recovery. And I suppose this is the last thing I want to think about, is that really it has been a pretty unpleasant week. It hasn't been horrendous. I've been beautifully looked after. I got home within 48 hours of the operation. I am physically pretty healthy now, and I'm doing very, very well, and I anticipate going back to work without any major problems. I know that my long-term risks of high blood pressure and of kidney problems are higher than they were this time last week. I know that from some of the tests I've had, a few other things that have been picked up with my heart that are going to need follow-up. But I also know that although I signed the strangest consent form in the world, in other words, I signed a consent form where basically there were a whole bunch of risks and no benefits, I know that there are some real benefits. And I'd like to just finish with thinking about what those benefits are, because I really think this is important. The first benefit, and the most obvious benefit, is watching my sister's kidney functions go from grossly abnormal to the point that she'd have needed dialysis within the next couple of months to being better than mine are now. Actually, her numbers are better than mine, and her numbers are identical to my pre-op levels. This is just unbelievable. It is the most extraordinary thing. And I know that I have been through a pretty unpleasant week, but I've done it, and I've done something that really is very special. And that is something that is life-enhancing and life-changing for me. And I don't mean that in a heroic hurrah for me sort of way. And there is some of that, and I know that some of the lovely things that people have said to me have made me feel really like this is quite a cool thing to have done. There's no doubt about that. There's no getting away from that. But at a very deep level, I know that I've done something cool. And that is important. And however this goes, however long that kidney lasts, I know that I did that thing. And that's not something that is a trivial minor thing. The second thing, I suppose, is it has given me a new respect for my own body. I'm the luckiest person I know in terms of my own physical health. And I don't take that for granted the way I did a week ago. Because there have been times in the last week where I felt pretty terrible, and I felt like this was the worst decision I'd ever made. And I know that I have taken a decision that makes me less healthy. And so for the first time in my life, I'm really not taking that health for granted. And I have a sneaking suspicion I'm going to look after myself better for the rest of my life as a consequence of what I've learnt in the last few weeks. That's a physical thing. I think it's also a psychological, spiritual and emotional thing. And I think going through something like this is actually very important for getting you to look at who you are, what's important, how do you feel about things, how do you really want to think about yourself as a human being. And again, I think those are important conversations, one of which is conversations I've had with my sister and with my family, and I wouldn't for 1 second want to take away how much better we know each other for having been through this thing together. And that bond that we have before, after and during this operation is something that's really special, and I do believe is a benefit. Although I know that my physical risks long term are worse, as I've mentioned, than they were a week ago, I also know I'm going to be incredibly well looked after for the rest of my life. It is in everybody's interests that I do well. But part of the whole thing of whose interest it's in is the people who do the organ transplants. They need me to do well so that they continue to do the amazing work that they do. And therefore I will be monitored and followed up and looked after. And that is not a trivial thing at all. And I do believe that with the combination of my new respect for my body, the things I've learned as I've prepared my body for this operation, and that long-term follow-up, and that constant reminder of, you're not as healthy as you were before. I have a sneaking suspicion that actually this will be a very positive thing for me long-term. I don't know, but that's what I believe. So in summary, what I really hope I've got across today is that this is a really hard process. I can't sugarcoat that. I could have avoided this, I would have done. But having been through it, I can't imagine that we would have done anything different. And I don't regret for 1 second what I've done. And I would really want people to think very hard about the decisions that they're going to make, the conversations that they're going to have, and how they approach these things if they're ever in this situation. And I'd really want clinicians to be aware of some of these issues as well as they approach working with patients and their families with chronic kidney disease or some other form of chronic organ failure. Thank you.